Okay, my name is Andrea and I am presenting on medial epicondylitis, also known as golfer's elbow. It's most common in throwers and golfers, and according to an article I read, they classified it into different terms. So acute injury resulting in inflammation is termed epicondylitis, and epicondylosis or epicondylopathy are termed due to repetitive forces and structural changes. And epicondylalgia is elbow pain related to tendinopathy. So mechanism of injury can be acute or chronic. For acute, there's a large valgus force with medial distraction and lateral compression. And chronic is repetitive forces, valgus forces, and it's the most common mechanism. Signs and symptoms: swelling, pain and tenderness at the flexor pronator origin, restricted movement, valgus instability, and decreased grip strength. For evaluation, active range of motion, there's pain with pronation and wrist flexion, like we said before. Resisted range of motion, there's decreased strength and pain in wrist flexors and forearm pronators. And there's also pain at end range wrist extension with an extended elbow. And for this, you want to make sure to evaluate everything to rule out other conditions, because there's a lot of things that can go on in the medial elbow. And another article I read classified 4 stages of injury. So stage 1 shows distinct injury with normal inflammatory response and resolution, and this stage corresponds to epicondylitis, like I said before. Stage 2 injury is from repeated microtrauma over time and corresponds to epicondylosis. Stage 3 is a partial tear plus fibrosis, tendinosis, and calcification, and corresponds to epicondylalgia. And stage 4 is a continuation of stage 3, but with a complete tear. For management, conservative management works just fine. So rest, ice, compress, elevate, NSAIDs, electric stim to reduce pain, soft tissue mobilization, eccentric strengthening, bracing, and you want to correct form, especially in throwers if you can, because if they throw like sidearm, then that puts stress on the medial elbow. And patients not responding to conservative treatment after 6 months to 1 year, you can opt for surgery. And then some stats that I found. Medial epicondylitis makes up approximately 10% of all diagnoses of epicondylitis, so it's far less common than lateral epicondylitis. The highest incidence rate occurred in the population of over 40 years, so their stat was 2.56 per 1,000 people over 40. And it occurs most commonly at the flexor carpi radialis and pronator teres origins with no involvement of the flexor carpi ulnaris tendon. And that's what I got. Any questions?